Hello class, this is Mrs. Alston talking today about the thoracic spine and its anatomy. Now remember, with a typical cervical spine, you're going to have some special characteristics of the transverse foramen within the transverse process and the bifid tips. With the thoracic spine, you have some characteristics of its own. You're going to have an articular facet that's going to articulate with the rib, particularly the tubercle of the rib, forming the costotransverse joint. Now it forms that joint because that articulation is on the transverse process. So the tubercle of the rib and the transverse process of the T-spine is the costotransverse joint. Now you'll also have facets and demifacets, and they are going to be on the superior portion of the vertebra and inferior portion of the vertebra. So here are the two demifacets, and this is a facet here, and that allows for the articulation of the head of the rib with the body of the T-spine, forming the costovertebral joint space. So you have a costotransverse joint space from the rib, which is going to be from the transverse process and the tubercle, and then you have a costovertebral joint space, which is formed by the head of the rib and the facet or demifacet of the T-spine, which comes off of the body of the T-spine. Now remember, most of your vertebra are going to have a body and an arch. So here you have the body, and then here's the arch. You still have a superior articular process and your inferior articular process, which is right here. And then this is your transverse process sticking out laterally right here. But the superior and the inferior are considered the ear and the leg, so they're going to form the zygapophyseal joints. So when you put these together, let me go up here so you can see right here, when you put these two together, right here, you are forming the zygapophyseal joint. So this is the inferior articular process of the superior vertebra and the superior articular process of the inferior vertebra, making up that zygapophyseal or apophyseal joint space right there. Now you notice that the spinous processes don't have that bifid tip back there. And when you look at the arch, it's still made the same way. You've got the vertebral foramen, which is where the spinal cord is going to go through. You have the pedicle, which is right here, attaching the arch to the body. And then you'll have the lamina, which is right here, the area between the transverse process and the spinous process. So this area right here is the lamina. So that is your typical thoracic spine. Now when you are performing your obliques for your T-spine, you will notice the zygapophyseal joints, okay? But when the patient is in a true lateral position, that's when you're going to have your intervertebral foramen opening, or this opening right here, okay? And that is formed by the inferior vertebral notch of the superior vertebra and the superior vertebral notch of the inferior vertebra. That makes that intervertebral foramen. Now remember, the only vertebra, or the only foramen that is naturally formed without having to put anything together is going to be your vertebral one, and that's formed by already the fusion of the vertebral arch with the body of the vertebra. So that is your typical thoracic anatomy.